Hi, I am Stephanie Dolisevai Ana Asap, and my group will review on the prevalence of back pain among nurses working in government health clinics and hospitals in Port Dickson, Malaysia. First of all, for introduction, what is back pain? Back pain is any discomfort or pain at the back in the past 12 months, whether it's upper back, middle back, or lower back pain. Okay, the research is conducted as nursing is an occupation that associated with high rates of developing back pain due to their nature of work practice. So the question here, what are the factors that associated with development of back pain among nurses? Okay, as hypothesis, there are three factors that associated with prevalence of back pain among nurses, which are socio-demographic factors, physical and work factors, and psychosocial factors. Through this research, it helped us to determine the prevalence of back pain among nurses and the factors associated with it.
Assalamualaikum and hi, my name is Turushaidah binti Muhammad Ali. Today I will explain about the method. These research are using a quantitative research methods, and for the methods of data collection, it used the method of self-administered questionnaire, assessing personal and social demographic characteristics, back pain, work factors, and psychosocial factors. This study involved 126 nurses and it took place at the head clinic and district hospital in Port Dickson. Besides, it took 1 month to finish. This study started from March 2007 until April 2007. Next, I will explain about the self-administered questionnaire. Is used that contain 3 factors that may be associated with back pain among nurses. First, socio-demographic characteristics such as age, marital status, number of children, and abnormal BMI. Second is physical and work factors such as characteristic association between work characteristics, monotonous work posture, awkward body position at work. Third is psychosocial factors such as work psychosocial factors involvement, perceived workload, work dissatisfaction, low support from co-workers, and low support from management. That's all from me. Thank you.
Hi, Assalamualaikum. My name is Muhammad Firdaus bin Baharuddin. Okay, so now I will explain about study objective of this research journal. Okay, first is lower back pain is a major occupational problem, especially among nursing staff nurse. Adakah sakit belakang ini merupakan masalah pekerjaan yang besar, terutamanya dalam kaki tangan kejururawatan? Alright. Yang kedua ialah to evaluate the prevalence of low back pain among nurse and to look for physical and psychosocial risk factor. Ini adalah untuk menilai kekerapan sakit belakang di kalangan jururawat dan apakah faktor risiko fizikal dan psychosocial. Dan yang ketiga adalah to identify a treatment for personal and occupational characteristic among nurse of intensive care unit. Ini adalah untuk mengenal pasti rawatan terhadap ciri-ciri peribadi dan juga pekerjaan di kalangan jururawat unit rawatan rapi. Baiklah, sekat ini penjelasan saya akan serahkan kepada Faizuddin untuk menyambung lebih lanjut mengenai objektif seterusnya. Sekian, terima kasih.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Faizuddin BCMah. I will continue the presentation of the objective that Firdaus has just presented. Okay, objektif seterusnya ialah determine associated factor among the nurses working in the hospital. Maksudnya adalah untuk menentukan faktor yang berkaitan sakit belakang ataupun back pain dalam kalangan jururawat yang bekerja di hospital. Faktor seterusnya ialah untuk menentukan kekerapan dan keparahan sakit belakang ataupun back pain dan faktor yang mempengaruhi pada jururawat yang bekerja di unit rawatan rapi. Faktor yang terakhir ialah to examine the relation between lower back pain and manifestation of human activity. Maknanya untuk mengkaji hubungan antara sakit belakang ataupun back pain dan manifestasi aktiviti manusia. Sekian, terima kasih.
Assalamualaikum, and my name is Handa Saliha. Saya akan terangkan main finding this article. Based on personal and socio-demographic, there are 126 total of nurses that participate in this study with response rate of 88.3%. Malay nurses were majority 85.7% and the rest were Indian 90.5%, Chinese 1.6% and others 3.2%. A bigger proportion 54.8% were 40 years old or less. Nurses that were married 87.3% had more than 2 kids 53.2%. Most of the participants were working in health clinic 54% and had been working more than 10 years 55.6%. For BMI, most of the nurses fell into the obese and overweight category 72.2%. However, none of these factors showed a significant association with back pain. The prevalence of the back pain was 79.4%. Most common site to develop back pain among nurses was at the low back. 51 participants claimed to have a mild pain, 72% claimed that was work-related, 10% required to change workplace due to low back pain. Then we have a physical work. There are only 2 factors that have significant association with the back pain: workplace and having carried heavy load. For workplace, nurses working in health clinics 86.8% have a higher rate of developing low back pain than those who are working in hospital 70.7%. For carried load too heavy, nurses who answered yes was 89.7% have higher rate of developing back pain than those who answered no 74.7%. Both factors were statistically significant with p-value of 0.026 and 0.043. The last one is psychosocial factor. Nurses who have higher psychosocial factor involvement were those who claim to have higher workload, not satisfied with their job that given do not get help from the colleagues. However, none of these psychosocial factors were significantly associated with back pain. Thank you.
Hi, my name is Nur Ain Akila Mehdi Mazlan. So, sekarang saya nak terangkan berkaitan topik discussion iaitu word posture and awkward body position. Okey, kita selalu tahu banyak faktor yang mendorong kepada lower back pain among nurses. So, other factor when the word posture and awkward position show its significant intention. Word positions such as standing, working at work, and prolonged sitting have no significant internship with back pain among nurses. Okay, awkward body position such as bending, body twisting, neck extension, flexion, and twisting have also no significant internship. Other study found out that awkward body position is one of the risk factor of getting back pain. So maksudnya di sini kita tahu bahawa awkward body position ni salah satu risiko faktor dapatnya lower back pain among nurses. So when nurses bending to do some procedure, it will increase 6 times risk of having back pain.
My name is Siti Nurfairuz binti Muhammad Nasir. Okay, let's move to the discussion. From this research article that taken in health clinic and hospital in Port Dickson indicates that the prevalence of back pain among nurses was 79.4%, which is the highest compared to other workers, such as 67% in palm oil estate worker, 27.3% for garbage collector worker. Many respondents complain they always had pain in lower back area. It is because the possibility when the lower spine, or we call that lumbar region, receive the highest pressure when they lifting some weight. It is taken by the questionnaire. One of significant factors associated is the age. Nurses who age more than 40 years old is getting high risk for back pain. Due to that, someone getting older, they will have spinal damage when they are working too high. This is one of degeneration process by tissue loss function ability due to aging. From this research, the nurses who work in health clinic around Port Dickson complain they have higher prevalence of back pain compared to all the hospital. It is because the respondent on health clinic have more. Majority 48.5% who age more than 40 years old, while in hospital only 41.4%. ages that more 14 years old. As I mentioned earlier, that old age really is one of the reasons why they had more back pain than younger nurses. Okay, second significant factor, when nurses lifting any heavier weight than they should, so that the back pain among them will increase. As example, nurses help with lifting patients that more heavy than the nurses to the wheelchair, so that they need more energy to be used, and the risk of getting back pain is high. Other factor, it could be the distance load are being moved. When the distance are too far, it will need more energy to carry load. And then the second is technique, which is nurses not follow the correct body mechanic and they frequently of weightlifting. Okay, logically and theoretically, the ability to handle weight and the risk of injury really depend on the individual strength.
Bismillahirrahmanirrahim. Assalamualaikum. My name is Nurmaisara Nur Azman. So I'm going to show you about the psychosocial factors. This is the last factors involved in this discussion. So as you can see in this table, this table shows the results of the association between psychosocial factors and back pain. So there are 5 factors involved. Both psychosocial factors involve 9: perceived workload, work dissatisfaction, low support from co-workers and low support from management. Ketiga faktor ni di mana staff nurse tidak berpuas hati ataupun tidak berasa selesa dengan tugasan mereka, mereka kurang sokongan daripada rakan sekerja dan kurang sokongan daripada majikan, menunjukkan parantus tinggi yang mendapat sakit belakang. So most of respondent nurses, they would prefer to working as a team and have good supporting member as it could reduce workload which prevent from back pain. Instead, kebanyakan staff nurse mereka lebih memilih untuk bekerja dan bergerak secara berkumpulan kerana ianya dapat mengurangkan bebanan kerja mereka dan dapat mengelakkan daripada sakit belakang. So although the results in this article actually are not significant statistically, but there were other studies show relationship on these factors and back pain. Okay, so this is because from this article, the researcher was unable to conclude significant results to several factors due to small sample size of respondent and homogeneous in terms of gender, which is there are bias in gender. Sebabnya majority respondent yang involved dalam research ni adalah terdiri daripada staf jururawat wanita. So majority women staff such as staff nurse, they were exposed to these factors such as childbearing, house chores and other common factors like improper posture and weightlifting during doing the procedure. So kebanyakannya staf wanita ni mereka lebih terdedah dan mudah mendapat sakit belakang berbanding staf jururawat lelaki kerana mereka melalui fasa fisiologi melahirkan dan juga mengandungkan anak. So they have high tendency in having back pain, and this give impact to the result of this research. So I will pass to the next presenter to conclude this presentation. Thank you.
Assalamualaikum, nama saya Siti Nurzainah. Okay, in conclusion, back pain occur among nurses caused by various factors or challenges in working areas such as uncomfortable working position. As example, they're lifting heavy objects the wrong way, like they didn't bend their knees and didn't keep their back straight. It can affect their back muscles. So, as a nurse, be alert the right way to lift the heavy objects. Sometimes, some of nurses do their work without adjusting the bed to appropriate level. For example, during they check patient's blood pressure, this happen maybe because they are too busy to do other tasks. Other situation can lead a nurse to get back pain is during they transfer patient from bed to chair. Actually, patient's weight also the factor can lead nurse to get back pain. Besides, psychosocial like work pressure, workload and no support from colleagues, also the challenges among nurses risk to get back pain. Nurses can prevent back pain by doing the job the right way and taking care of their own safety. So that's all from me. Thank you.